Requirements. Today's presenter is Andy Petrovich, MCEDA's Security Risk Assessment Expert. My name is Liz Jones, and I am today's moderator. Before we begin, I have a few housekeeping items to touch on. We will be keeping the phone lines on mute during today's presentation. If you have a question for Andy, please type it into the questions box in your GoToWebinar interface. We'll take time at the end of the presentation to answer any questions you have. If for some reason we are unable to get to all of the questions, we will email you directly with an answer following the broadcast. We will also be posting a recording of today's webinar and a copy of the presentation slides on our website. Go to www.mceda.org. Hover on the Resources tab, then select Webinars. The information you will hear in this broadcast is current as of today and is only intended to be a general summary. Since policies change frequently, the best way to stay up to date on current requirements is to review the actual written law or regulations. We encourage participants to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their content. Today we will start out by giving you a brief overview of MCEDA and our various service offerings. Following that, Andy will take over and discuss what a security risk analysis is, why information security needs to be a priority for any medical organization, and how an SRA can help you improve your security and comply with various federal and state requirements. Following the presentation, Andy will take time to answer any questions posed by the attendees. Housed within Alterum Institute, we are MCEDA, the Michigan Center for Effective IT Adoption. Originally born out of ARA, and more specifically the HITECH Act, MCEDA is Michigan's regional extension center, tasked by the federal and state governments with accelerating the selection, adoption, and meaningful use of health information technology to improve the quality and efficiency of healthcare in our state. To date, we have assisted nearly 6,000 providers across Michigan, impacting 1.6 million patients annually. Ranked as the 5th largest REC out of a national network of 62, we are also funded by the state of Michigan to assist any provider participating in the Michigan Medicaid EHR incentive program. MCEDA's health IT services include the following. Number 1, meaningful use support at any stage and year. Providers participating in the Medicaid EHR incentive program also benefit greatly by qualifying for state-subsidized services that bring our highly rated technical assistance to you for only $200 per provider, a savings of 96% compared to commercial service rates. Number 2, security risk assessment, which is an embedded service within our meaningful use support. But if providers only need assistance with the SRA, for example, to satisfy the requirements of the new quality payment program, we offer it separately as a standalone service. Additionally, MCEDA is helping practices improve their technical security with the new Network Security Evaluation Service, which can be purchased to complement our other offerings. Number 3, attestation and audit preparation. If you are getting ready to attest and just need some peace of mind that you've crossed all the T's and dotted all the I's, or if you're one of the many folks who have been selected for an audit and need assistance responding, we are here to help. Number 4, targeted process optimization, or TPO, takes a stripped-down version of lean principles and applies them to any clinical or operational practice improvement initiative. No matter what you need help with improving in your clinic, we have experts on hand who can assist. Number 5, the Great Lakes Practice Transformation Network offers no-cost technical assistance to eligible providers in support of quality improvement initiatives, PQRS support, and preparing for upcoming advanced payment model changes under the new quality payment program. Number 6, our chronic care management program enables physicians to take advantage of the recently updated Medicare billing requirements for CCM services. We provide you with a dedicated care manager who works within your practice, helping fulfill CMS criteria to maximize your reimbursement potential. Contact us to learn more. And number 7, funded by the Centers for Medicare and Medicaid Services, the Quality Payment Program Resource Center for the Midwest provides free help to clinicians in small practices and rural or underserved areas as they navigate participation in the CMS Quality Payment Program. go to www.qppresourcecenter.com to join today. With that, I will turn things over to Andy.
Okay, thank you, Liz, and thank you all for joining today. Today we're going to talk about security risk assessment or risk analysis requirements. Those terms are largely interchangeable, and you'll see both today. Now, these have been required. Security risk assessment has been required since 2005 under the HIPAA security rule, and Meaningful Use has been drawing attention to this process since 2010. However, there's still a lot of misunderstanding about what exactly is required. So while we aren't going to be giving you legal advice today, we are going to be clearing up some of those issues and misunderstandings today and discuss why the SRA is important. So let's start at a very high level, and let's just think about what is risk. Well, in a way, everything entails risk. Out in the world, there are all kinds of various things to experience and to enjoy. And anytime you get out into the world, there are any number of bad things that can happen or things that go wrong. So how do you obtain security in this world where things are not necessarily secure? And the first step is awareness. When you have awareness, your context changes, and you are going to be in a position to prepare yourself from any risks that may be present. Now, this presentation is not about protecting kayakers from sharks. We're protecting patient information, and that's what we want to talk about today. Let's dig a little deeper. What are the reasons to assess risk? Well, we've talked about compliance right off the bat. The name of this presentation is Security Risk Analysis Requirements, but those requirements are in place for a reason, and that reason is patient safety. Patient information needs to be kept private, and it is to protect patients and their well-being. In addition to that, if information is breached, in particular that's legally protected patient information, that can impact the public perception of the organization that was affected. And there are any number of prominent examples I'm sure you can think of. And in addition, let's not forget compliance. It's very important. These rules are in place, and it is important to be aware of what the requirements are as well. Securing patient information is a legal requirement under HIPAA laws, and there may be state laws as well. These do vary from state to state. They may impose additional requirements upon patient privacy in addition to HIPAA, but none of the state laws are going to preempt HIPAA per se. Now, let's unpack each of these three. They're all good reasons. Let's take a look. We'll start with patient safety. A common motto of medical practitioners is first, do no harm, and keeping patient information secure is part of preventing harm to patients. Stolen patient records can be used for identity theft, credit card fraud, tax fraud, and other invasions of privacy. And recent figures shed a pretty bleak picture in some ways. Since 2015, over 131 medical records have been breached in the United States alone. That is a pretty significant proportion of the overall population of the U.S. And there are very serious consequences for the victims of these breaches. Average of over 12 million individuals are affected by identity theft annually, and the average cost is about $5,000 per household. And this can also be compounded with general privacy issues about medical information that people may not want to have public, and also treatment errors. If the medical information is modified, this can result in treatment errors and other issues impacting patient health directly. Public perception is a very important consideration for most organizations. I think we can all agree on that. People want their information to be kept private for a variety of reasons, and it's their right, and it is a priority for many people. According to a 2012 study, respondents rather presciently expressed concern over the security of electronic health records. 81% reported having concerns about the privacy and security of EHR, and 60% of patients reported the belief that EHR use will result in more information being lost or stolen. A more recent study done by FireEye just last year shows that consumers in general use public data breach information to inform who they may do business with 76% of consumers reporting a willingness to seek new providers after a breach. And some other considerations regarding the erosion of consumer trust, or in the medical office case, patient trust, it may result in the patients being unwilling or less likely to share accurate and complete information with their providers if they believe that that information isn't going to be safeguarded appropriately. And it may also make patients or consumers less forgiving in the event of a breach or privacy issue, which could result in legal action being more likely as well. And last, but certainly not forgotten, is compliance itself. Breaches can happen to even the most sophisticated organizations, and if you're not in compliance, it can result in direct costs being applied to you or your organization through enforcement actions. Those enforcement actions are going to be the most severe for organizations that have not completed accurate and thorough risk analyses, and this has been consistently the case in particular in OCR, Officer of Civil Rights enforcement actions enforcing the HIPAA laws. Additionally, a lack of or incomplete security risk analysis is the main reason that providers have failed meaningful use audits. And that is expected to continue to be an issue in the ongoing quality payment program under MACRA. The requirements are generally the same, and we'll get to those later in more detail. But based on trends, analysis is not going to be reduced in importance, and providers and participants are going to have to continue to get up to speed of those requirements to make sure that they are meeting all requirements of the quality payment program. Ineffective security measures can result in other direct costs, such as legal action, loss of access to your data, which could impact your revenue streams, and then also issues with contractors and vendors if there are disputes about contract language or security practices. And we'll also talk about ransomware here in a moment, which is a very pertinent manner of cost being imposed on medical practices. Overall, risk is on the rise. Healthcare is one of the leading industries with the dubious distinction of having among the most data breaches of any U.S. industry. Costs overall associated with risk to health information are expected to rise as the risk of security breaches continues to rise steadily. Healthcare is one of the most commonly breached industries in the U.S., as I said, and it's largely due to the value of health information. It's also due to the historically less strong security practices taking place by healthcare organizations, often due to budgetary constraints, but also due to the often sprawling and complex nature of a hospital campus or healthcare organization in general. Now, EPHI breaches are increasingly attributed to hacking attacks, and this is a shift that occurred a couple of years ago. Previously, I should say historically, insider threats were the primary cause of health information being breached. Now we have seen in the last 2 years a shift to external hacking attacks being attributed to the breaches. We'll talk about both of those shortly. The question is, how can healthcare providers protect their data? As we're talking about today, a key to protecting the data of your organization as well as the health information of your patients is to perform accurate and thorough risk assessments to understand where your risk exists. Risk needs to be managed continuously, and some specific implementations that medical providers can put in place to protect information is to utilize encryption when ePHI is being transmitted or stored locally. You also want to make sure that staff and providers are trained on how to properly protect ePHI. And when you're doing risk assessments, make sure you're including all devices in your practice. This would include medical devices, ancillary devices, any of these devices, even devices that may not store or process patient information, could be used to gain a foothold on your network, and so you want to consider those as well. All right, so as I promised, we're going to talk about ransomware. You hopefully have heard of this. There's a very prominent worldwide incident involving ransomware very recently, and over the past year, ransomware has been impacting healthcare organizations to a very high degree. We've seen a shift in healthcare breaches where previously the hackers would basically steal the health information and then try to sell it in the black market or use it for other nefarious purposes. Ransomware is a little different. What is ransomware? It is malware that removes access to your data using encryption and demands a ransom be paid before access is restored. So this is a different way to monetize illegally health information. So why is healthcare being targeted? One big reason that healthcare organizations are being targeted so heavily by ransomware is the urgent need to use that data, especially hospitals or urgent care or an ER situation. They need that information right away, which definitely is a piece of leverage for hackers to get the ransom paid. Importantly, ransomware is typically delivered through phishing email attachments, and this is a phishing email is an email that is spoofed to look like a legitimate email. You click the link, and it leads you to an illegitimate website. So these attachments or links will lead you to malware that is then affects your system, encrypting your data, and you will see a screen, such as the screenshot in the upper right corner, that says your files are encrypted. It will have a countdown clock often, and you will have a means to communicate indirectly with these hackers and pay the ransom. However, there's no guarantee that paying the ransom will restore access. After all, these are criminals, and the fact that they're engaging in this behavior already shows that they're not necessarily willing to play by the rules. So how can you protect yourself and your organization from ransomware? The most important thing is to back up your data, especially on a separate system, such as a cloud system, that's not constantly accessible from your workstations. And want to test your backup and restoration of your backed up data regularly. You also want to make sure your staff are trained on good security hygiene and how to avoid and identify phishing attacks. Make sure that you are up to date on your antivirus and anti-malware software that's installed on your systems, as well as keeping your software applications current with the most recent updates and patches. And another way to help protect yourself against ransomware is to minimize the use of administrator accounts on your computers, and this can prevent malware from being able to effectively install itself on your machines. So you've probably heard a lot about hacking attacks in the news recently, and we've just spent some time talking about them. And they do get a lot of attention for good reason, but let us not forget the ever-present insider threats. Mitigating insider threats must be a high priority for healthcare organizations and organizations in general. As I said, historically, they were the primary cause of health breaches, and they still constitute a significant proportion of overall healthcare breach events. So what does an insider threat, what is constituted by that? You have potentially any improper internal use of records. It could be intentional, it could be unintentional. It could be malicious intent, there could be a benign intent. It could be if you have personnel who gossip or brag about having insider knowledge on sensitive information, including patient information. These would not necessarily be malicious actors, but they certainly pose an insider threat. You may also have malicious individuals who are seeking to utilize sensitive information in a way that is deliberately counteractive to your interests, such as funneling information for a private commercial venture, or also selling information, for example, for the purposes of tax fraud. So perimeter security is important, and often when we talk about security, it tends to be the focus, but you also need to make sure you have security within your organization to help you manage and maintain appropriate access to sensitive information, especially EPHI. So with that in mind, consider administrative, physical, and technical access. So now that we have set the stage and talked about some important security topics, let's review important requirements and definitions that pertain to security risk analysis. And to begin with, it will be important to define EPHI. We've referred to this a couple of times now. And by EPHI, we are referring to electronic protected health information. Now this is a definition under the HIPAA rules, and I've provided it here on this slide. Protected health information is information including demographic information that relates to the individual's past, present, or future physical or mental health or condition, relates to the provision of health care to the individual, or past, present, or future payments for provision of health care to the individual that identifies the individual. And electronic protected health information is simply the electronic version of what I just described. So you do need to make sure that PHI and EPHI are secured within your organization and when you're using it. You can also de-identify protected health information following guidance on the HHS website, which is linked at the bottom of this slide. And if you access the slides after the presentation, you will be able to link directly to that guidance. Next, we need to know exactly what is required when referring to security risk assessment or risk analysis. So there are two main ways to look at it, and the first is the HIPAA security rule definition provided here for risk assessment or analysis. And that is to conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information held by the covered entity. And by covered entity, that refers to, for example, a healthcare organization that is subject to the HIPAA laws. That is the HIPAA definition, and meaningful use and quality payment program requirements are based on this definition, as you'll see here. So the objective is to protect electronic health information created or maintained by the certified EHR technology, referring there to the ONC certification, through the implementation of appropriate technical capabilities. More specifically, conduct or review a security risk analysis in accordance with the requirements listed above. That is the HIPAA rule right there, which includes addressing the security of EPHI created or maintained by CERT. And you're also looking at encryption. And this is referred to in both the meaningful use and quality payment program language. So what you can see here is that meaningful use and quality payment program, also you may think of this as MIPS or MACRA. The language is the same, the requirements are the same. So if you're doing a security risk analysis that meets HIPAA requirements, you're also going to be doing a risk analysis that meets the meaningful use and quality payment program requirements. Three birds with one stone, so to speak. So you may have noticed encryption being included in this discussion, and let's take a look to unpack that very quickly. So encryption is considered an addressable specification under the HIPAA requirements, and some have taken this to mean that it's optional. However, it is not optional. If you're not going to encrypt your data, you need to have, first of all, a very good reason that it is impossible in the first place. And then you have to have an equivalent safeguard in place to compensate for the lack of encryption. And this would apply to data in transit or at rest. Under HIPAA, encrypted EPHI is considered secure and therefore protected from a breach. This is referred to as a safe harbor. So if you have an external hard drive, for example, with patient information on it, and it is encrypted, if that hard drive goes missing, then you do not necessarily have to report it as a breach. Meaningful use and QPP deliberately draw attention to encryption in the new final rules to emphasize its importance in securing ePHI. At this point, it really is a standard, and there's not much justification for not encrypting in those situations that will pass muster. And so again, just recall that ePHI should be encrypted at rest, that is when it's being stored on a local device, and in transit. So now that we've discussed some of these fundamental requirements, let's take a look at a standard definition of risk. And this is based on the NIST definition under Special Publication 800-30. Risk is the potential or likelihood of a negative outcome or impact toward an asset due to a vulnerability being exploited by a threat that would reduce the value of the asset to the organization. And we're going to look at each of these terms specifically, but just to unpack this definition a little more, consider a laptop computer. Its portability and ease of moving it around is a benefit, but that ease of moving it around can also be exploited for illegitimate purposes, such as theft. This exactly presents a vulnerability. The willingness for someone to steal the laptop is a threat. The likelihood of that happening and the outcome of that happening represents your risk. So if you noticed in the HIPAA definition, it referred to risks facing the confidentiality, integrity, and availability of ePHI. So let's take a look at what exactly is meant by that. By confidentiality, that means that the information is kept private and only used appropriately. When this is compromised, the patient's identity could be in question, among other harms. Integrity refers to that the information is accurate, complete, and up to date. For example, if a patient's chart or medical record reads "do not resuscitate" or "no allergies to medicine," you need to be able to trust that that information is accurate in order to perform care safely and effectively. And finally, availability means that the information is accessible when needed. If you can't access the information, then it's not going to be of much use to your medical practice. And when any of these three variables are compromised, it reduces the overall value of ePHI. Essential to understanding risk is understanding vulnerability. So let's take a look at vulnerabilities and controls. For valuable assets, you need access to utilize the value of that asset. And systems that are designed to permit access, but the permission of access represents a vulnerability. So you also implement controls to reduce or eliminate unauthorized access, but there's no way to do it 100%. So consider a vault as an example here. You have valuable things, you don't want them to be carried away, so you put these valuable things in a vault to prevent unauthorized access or utilization. You also want to enable legitimate access, so you install a door in your vault. The door will be designed to make access difficult if it is not authorized access, while enabling necessary or authorized access. The door represents a control to protect against the vulnerability of the assets stored in the vault. And depending on how much or how frequently you need access, controls can vary accordingly. So again, with a bank example, consider that the bank does not want to have to go to the vault every time a transaction is made, so some smaller amount of assets are stored in more easily accessible areas. Threats are also essential to understanding security, and they come in many different forms and from different sources. External threats, I think we all can really understand what those might look like, such as hostile outsiders, thieves, or saboteurs. And these are all things outside of your organization that you don't really have direct control over that still could pose a serious impact to your organization. Internal threats are present as well, and this could consist of a malicious insider, someone who is actively trying to undermine your organization. It could also be inconsistent enforcement of policies and procedures, especially security policies. Staff curiosity or other seemingly benign attributes of staff behavior, such as human willingness to gossip or boast, can also pose a very serious internal threat. And then you also have shadow IT, where people may be bringing devices into your network unknown to ownership or administration. These can all pose threats from an internal source. And at the intersection of internal and external threats are business associates. So let's take a look at what those are as well. What is meant by business associate? It's a legal definition under the HIPAA privacy and security rules, and it is third parties to a covered entity which access, process, store, or transmit PHI. They are considered business associates, and they need to sign a business associate agreement. You have to have business associate agreements in place with any third parties who meet the definition of business associate, which is basically any who access PHI or ePHI. Additionally, any existing business associate agreements needed to be updated in 2013 to account for omnibus rule requirements, and still occasionally encounter some business associate agreements that have dates prior to 2013 on them. They should generally, they need to be updated upon any change or renewal of contract. Typically, these agreements are going to be addendums to your normal contract with the provider of whatever service or product you might be seeking. So whenever that contract gets renewed or updated, the business associate agreement needs to be updated as well. So it should be a fairly regular thing. Now, business associates have serious responsibilities to protect the confidentiality, integrity, and availability of ePHI. Many breaches are due to business associate activity. You can also have disputes regarding data access and data integrity depending on the terms of the business associate agreement. You need to make sure that's spelled out clearly. If the contract terminates, what happens to your patient's information on the business associate end? That's very important to consider. It's also very important to be aware of the fact that business associates are subject to Office for Civil Rights enforcement actions pertaining to the HIPAA requirements. And getting the business associate agreement in place is the critical first step in your third-party relationship for any vendor that's going to have access to ePHI, but it's equally important to consider ongoing vendor management, including security. Are you really aware of how they're securing your patient's information? Are they aware of what the requirements are that they signed up for when they signed that agreement? One thing to consider is, would your vendors or business associates pass a HIPAA audit? They may have to. Just last year, the HIPAA audit program phase 2 began in earnest. So you may have heard about these random HIPAA audits, and they are currently ongoing and expected to continue into the future. HIPAA audits could pertain to any HIPAA-covered entity or business associate. They are all eligible for selection. The Office of Civil Rights will communicate with selected participants via email, and you may not see these emails, so make sure you are checking your junk and spam folders and search for OCR to see if they are reaching out to you, because if you don't get back to them, that doesn't exclude you from participation. 2016 auditees were initially contacted in July, and as I said, those audits are ongoing to this day. Primarily, we're looking at desk audits where covered entities and business associates will be asked to provide documentation on HIPAA compliance to the Office of Civil Rights electronically. In particular, documentation on key HIPAA requirements. Importantly, the security risk analysis requirement. They also want to see an inventory of your business associates. So make sure you have a list of business associates kept up to date at all times. And you're going to have a pretty short time frame once those requests are sent out, so it is important for you to have your documentation in order before you are audited. There are also a smaller number of on-site audits which are set to occur in 2017, but we don't have a lot of information on the results of these audits. Stay tuned. So now for the moment you've all been waiting for, we're going to review the process of conducting a risk assessment. The process we'll describe is based on the Department of Health and Human Services' final guidance on risk assessments. As with most requirements of the security rule, if you're familiar with it, I'm sure you're aware of this, healthcare organizations are given quite a bit of flexibility in exactly how they perform a risk analysis or assessment. There's no one-size-fits-all method required, but all risk assessments need to meet the basic criteria that I'm going to lay out for you right here. And the first is to identify and classify your assets. By this, we're referring to any devices within your organization that process, store, transmit, or maintain patient information, ePHI. As I said before, you want to make sure that you're comprehensive in your scope. Your risk analysis needs to include any devices that access EPHI or devices that could be used as a foothold to your organization. And while the meaningful use rules specifically highlights EPHI that is maintained within the EHR technology, you want to make sure that you are more comprehensive in your scope, looking at all of your devices to meet the HIPAA requirements. The next step is to identify and classify threats and vulnerabilities. Consider the vulnerabilities inherent in your device's infrastructure and environment. For example, some medical devices may only operate on a computer that is using Windows XP. It's very outdated. If this is the case, you need to implement very serious mitigating controls to minimize the impact of that vulnerability in the presence of it. You also want to consider the various sources of internal and external threats that could compromise the security of your EPHI. Step 3 is to assess your current controls, that is to say the safeguards you have in place protecting EPHI at the time of your risk analysis. Surely you already have controls in place to protect your assets. What are they? How effectively do they mitigate the identified threats and vulnerabilities that you just considered in your risk analysis? This is the next step. From there, based on your assessment of controls, you need to determine the likelihood of a threat occurring and actively exploiting a vulnerability. Some threats are more likely than others. In order to assess risk, you need to factor in the likelihood of a threat occurrence or the vulnerability being exploited. You must also factor in whether a potential threat being actualized or manifested, what would be the impact to your organization? This impact assessment is what would happen if a vulnerability were exploited or a threat activated on your organization. What devices would be affected? How much EPHI could be exposed from those devices being compromised? From the likelihood and impact determinations, you will determine your risk score. This is determined by combining likelihood and impact. For example, high impact, highly likely adverse events would be considered high risk, while low impact, unlikely events would be considered low risk, and so on. From these findings, the next step will be to implement security controls. You need to implement improved security controls to better mitigate identified risks facing your organization based on what you've determined from your risk analysis. When determining which controls to implement, consider cost and the effect on your overall healthcare organization. Really, managing risk is a balancing act. Controls don't have to be major impediments to your ongoing operations, but at the same time, you need to keep in mind that the costs of a breach are severe. Ongoing risk management is a continuous process of assessing and mitigating risks as they emerge and change over time. Your organization needs to be nimble and flexible in its awareness and response. And when it comes to HIPAA, for security risk analysis, as with all of the HIPAA security rule requirements, your steps to compliance must be documented. Documents should be retained for at least 6 years. In addition to this, states may impose longer requirements on document retention. For the security risk analysis itself, the meaningful use programs and QPP do not impose additional requirements on what HIPAA requires for the process, but they do have some requirements for the programs, that is, referring to the scope and the timing of the analysis. So for both of these programs, they must take place during the calendar year of your reporting period and no later than your attestation date. They also must assess your EHR technology and devices using EPHI. And they have to be completed for every reporting period or attestation that you will be completing. and you want to make sure that you are not attesting until after you've conducted your security risk assessment for that particular reporting period. A common question is how often risk assessments need to occur. For practices participating in Meaningful Use or QPP, a security risk assessment needs to be completed or updated for every year of attestation. Also, after you upgrade your practice, your technology, or to your environment, you should also update your security risk analysis accordingly. For HIPAA compliance, recommendation is at least annually. So this is basically the industry standard, largely due to the frequency associated with meaningful use. Historically, you may have seen organizations doing risk analyses less than annually. At this point in time, annual is the norm. And then you also need to consider risk management as a continuous process along with your risk assessment. So make sure you have documentation to support these ongoing activities. Many healthcare organizations do struggle with the risk assessment process. This is understandable, and MCEDA is available to help you. Our process is based on NIST guidance, which is the standard for HIPAA compliance, and I've referred to a couple of the specific special publications under NIST regarding risk analysis and HIPAA compliance. With MCEDA, we will have experts who work on site with practice leadership to review your current requirement or your current safeguards, how they stack up against requirements, what threats and vulnerabilities face your practice. That is to say, we will guide you through every step of the security risk analysis process. We also will deliver analysis, a recommended plan of action on how you can improve security and compliance, and tools to improve security and compliance. This is an example page from our security risk assessment tool, and you can see that it organizes the information about your practice, and we use this to analyze the risk-facing organization, again, following the previously described framework for risk assessment. And as I said, in addition to assessing and analyzing your risk, we also provide a corrective action plan with recommendations for improving security and tools to help you improve security and compliance, such as policy templates. And I've pictured one here. These will be templates, so you do have to customize them to your practice because there is really no one-size-fits-all solution for security, but these templates have language addressing the requirements of the HIPAA security rule and will help you get on the right track. And with that, we're near the end of the presentation. I'll leave you with a few take-home points to consider. Security is an investment in your business. All stakeholders benefit, from patients to ownership, providers, personnel. When your practice is securing patient information effectively, everyone benefits. The best way to make sure that information is secure is to build a culture of security awareness from top to bottom. This will help to mitigate insider threats, and you need to make sure that top management or ownership is on board and everybody in the organization is involved in making sure security is a priority. You want to implement, refine, and enhance your security policies and practices. These can be updated and refined on a continuous basis as part of your risk management program. Also, treat your business associates like insiders. Get the assurances you need to trust their security practices. A very important note is that compliance does not equal security. If you are compliant with the HIPAA security rule requirements and implementation specifications, that is really the minimum standard. Security, to truly be secure, you must go above and beyond those requirements. Also, completing a security risk analysis does not mean you are totally HIPAA compliant, but it is the critical first step to obtaining HIPAA compliance. I provided some resources here. Again, if you do access these slides after the presentation, they will hyperlink directly to these publications. And these are all good resources for you if you have questions about how to implement your security risk analyses. and security risk management program. You can also search them on your preferred search engine, and using those titles, they should come up readily. With that, if there are any questions, I'll be happy to discuss. Thank you for your attention.
We have had a few questions come in during the presentation. As a reminder, if you have a question for Andy, you can type it into your questions box in the GoToWebinar interface. The first question is, would an MCEDA security risk assessment constitute a HIPAA security risk analysis if audited?
It's hard to say exactly, but the short answer is yes. Our process is based on HIPAA requirements. It is based on NIST guidance. Historically, organizations that were examined by the Office of Civil Rights and have had our risk analyses did well. However, that's not to say that our risk analysis stood alone. So the analysis, as I said, is one piece, and getting this in place doesn't necessarily guarantee that your organization is going to be compliant overall. Anyone who comes to you and says, we're HIPAA compliant, or this will guarantee HIPAA compliance for you, or that our devices are HIPAA certified, for example, there is no HIPAA certification. It doesn't exist. The only way you'll ever know is to be audited, and then you'll find out. If you do have our process in place and it's thoughtfully acted upon, then you will have a very good foundation and a good tool for facing any of those kinds of compliance actions or investigations.
Where can the HIPAA policy templates be found?
So our templates are part of our process, and those can be attained by working with MCEDA, either through meaningful use support or the risk analysis as a standalone service. But those are delivered as part of the resources bundle to our clients who work with us.
We bought a cloud-based EHR with a secure connection. Do we still need to perform an SRA?
That's a good question, and the answer is yes. This is something that I've seen, unfortunately, some marketing materials for cloud providers will say that security is covered and that takes care of the risk analysis requirement for meaningful use. Unfortunately, practices that did not do their own risk analysis on top of having a secure connection with their cloud provider are not going to be very likely to pass the meaningful use audit, and certainly they're not going to have the requirements in place for HIPAA. The risk analysis is not only about the servers that are storing the information, which in this case would be under the control of the cloud provider. The security risk analysis also needs to include all the devices that are accessing that information. So your workstations in your practice, tablets, whatever you might have that's accessing the cloud computer, that needs to be assessed as well. And your cloud vendor isn't going to be in a position to do that. Only the practice itself is going to be able to do that.
Do you have an estimate of the cost for an MCEDA SRA?
We do have pricing available, and I'll be happy to reach out to you to discuss that. It can vary from organization to organization, and we do also offer discounts for returning customers. So if you've worked with MCEDA in the past, you definitely want to reach out to us and see what opportunities might be present there.
We did an SRA for meaningful use, but are worried that the SRA will not meet requirements. What do you recommend?
Okay, so for requirements, I mean, that could be meaningful use requirements, that could be HIPAA requirements. For HIPAA requirements, the most important thing is to document and then act on the risk analysis, and then also, check your process against the process that I described. For meaningful use, and then going forward for QPP, the timing and the scope are also very important to make sure that you're meeting those requirements. So it needs to be, the risk analysis needs to be conducted after your EHR has been implemented, before your attestation, and it needs to be during the calendar year for which you're testing or reporting. And the scope needs to include, for HIPAA, it's really all EPHI within the organization. There are statements within the meaningful use and QPP objectives that kind of truncate this to the EHR itself. But even then, any devices that are accessing the EHR need to be included. and then also the physical facilities and safeguards for your physical plant that house the devices that are accessing the EHR technology. So it does need to be more comprehensive than just the EHR itself. So I would recommend making sure that your risk analysis is examining all EPHI in your organization wherever it may be accessed. And we'd be happy to discuss that directly with you as well. If you want to reach out to us, and we can reach out to you.
We are a small, independently owned medical office. Do all of the security rule requirements still apply to us?
Yeah, they do. The security rule is pretty high level in the way it's written. So organizations are required to have something in place that needs to be documented for each of those various requirements. Now, when it comes to the implementation specifications, some of them are required, some of them are addressable. But as I said before, addressable doesn't necessarily mean optional. However, depending on the scope or the nature of your organization, some of the addressable specifications may not totally apply to your organization. So if that's the case, you still need to have a documented justification why. So make sure that that is considered and you have considered all of the standards and implementation specifications when it comes to your HIPAA compliance.
Do you recommend a business associates agreement for contract providers that are also a healthcare covered entity?
It doesn't hurt. In a way, it is redundant because the business associate agreement is obliging them to comply with rules they already have to comply with as covered entities. But there are also requirements that you may want to impose on them regarding your security expectations and practices. And it also can be very important to establish that data retention relationship. So if they're having data stored on their end, it's very important to make sure that you've outlined that. And in that case, a business associate agreement is definitely an important piece. So overall, if in doubt, err on the side of getting the business associates agreement in place. And one of the tools we provide is also a decision tree regarding, it'll outline you the exact steps and take you through each exact step. Which organizations do you need a business associate agreement with? And that is also publicly available, so you should be able to search for that if you have any questions.
Our SRA process revealed a lot of issues that will need to be addressed. How much of this needs to be done before we attest?
Okay, so yeah, that's a meaningful use question again. So risk management needs to be ongoing. And as the HIPAA rules are pretty flexible, you are given some leeway on this. It's hard to say exactly because when you're being audited, it's really at the discretion of the auditor whether or not you pass. So as much as possible, as much as is realistically possible, and even for those items that you may not be able to address within a reasonable time frame, have your reasons for that documented and also document the steps you've taken. So for some of these, you may be relying on third parties. For example, if you're submitting business associate agreements to third parties, you need to have them sign it and return it to you. There could be a delay there. So in those cases, just make sure you've documented when the business associate agreement was provided, for example. Or if you're looking at a vendor for an encryption solution and you're still in the process of shopping, keep those steps documented. And in that case, if you have items that haven't been fully addressed, you will have something to back up your activity. But in general, for a meaningful use audit, practices should have the majority of those items addressed by the time of their subsequent year's risk assessment or analysis. If in a year's time you haven't addressed the majority of those items on your risk analysis, it's going to be hard for you to say that you fully met the requirements of conducting the risk analysis and then implementing corrective actions.
Okay, those are all of the questions we have for now. As a reminder, we'll be posting a recording of today's webinar and a copy of the presentation slides on our website, www.mceda.org. If we have missed anyone's questions, we will email you directly with an answer shortly. Thank you everyone for attending and have a great day.